Dr. Singh, as a patient, what do I need to know about dental implants?
Some of the things that you should know about a dental implant is that it's a proven methodology. It's no longer considered to be an experimental technology. A lot of people say, well, it's kind of new, and how proven is it? Well, we have over 50 years worth of evidence to show that it does work, and it does work long term. It doesn't fail. Once you have an implant properly placed and properly restored, you can reasonably expect that to last the rest of your life. The crown may deteriorate, the top portion of it may deteriorate due to wear, etc. They're usually made out of porcelain, so something can potentially happen to that crown, but you would not need to replace the implant. So they are a good long-term solution. They're made from completely inert metal, and to date absolutely no reaction has been found to titanium. It's used in all kinds of surgeries, hip surgeries, etc. And it's a very safe and proven method of replacing a tooth. That's the first thing you should know. And other things that people should know is it could be very, very non-invasive. It doesn't involve any significant pain or discomfort once it's handled properly, and essentially most people are surprised that, at the end of the procedure. They ask, is that it? What else is coming? I didn't feel anything, and that's the way it should be. But it's come a long way in terms of from the first days of doing implants. Costs have significantly reduced because the original patents have expired and stuff. So it's a very affordable, very proven way of getting a dental solution, and in many cases it allows you to have a solution that without an implant isn't at all possible. So it's a proven technology, affordable, and there really isn't a lot to be concerned about.
As a busy executive or a busy person in general, how can immediate or single visit implants benefit me?
First of all, when it's done immediately, it's one of the best situations possible, because if a tooth, usually it's because the patient has fractured a tooth or something like that. If the root can be removed and the implant placed at the same appointment, in my experience, I've found that to be very efficient. The patient doesn't have to be frozen the second time. They don't have to leave the office with with a space, or they don't have to wear anything temporarily in between, such as a denture, etc., which might feel foreign to that patient. We're able to remove that root, place that implant, place a temporary abutment, which is the connector portion, and usually we place a temporary crown on, all in one visit. So the patient walks out looking like they have a tooth. Depending on the situation, when we think it's appropriate, that temporary crown would be replaced with a permanent crown once we've had some integration with the bone. And that may be within a month, or it may be in some cases 6 months later, if we think we need to leave it unloaded, meaning not a lot of force on it, to allow the bone to heal and integrate. Therefore, if we think the bone is weaker, we leave it a little bit longer. If the bone structure and the stability is very good, we might build the crown a little bit earlier. In the second scenario, if where a patient has lost a tooth previously, a long time ago, and there is the ability to, we're planning to replace it with an implant and a crown, say, we can again pre-plan that crown, so we have ideal positioning using their 3D scanning technology, place that implant in the same appointment, and go ahead and finish the crown on that same day if it's appropriate. Again, in most cases, we usually choose to leave it with a temporary crown for a short period of time until we're confident that we've got enough stability of that implant and we're not overloading it at too early a stage. In an ideal situation, it is possible to do an implant, an abutment, and crown in the same day. So you can pretty much get the whole process finished in one day in an ideal situation.